just go file order, right? Gaines. Okay, we're going to take the next bill. Just reminding everybody that we take bills in file order. And Assemblymember Beth Gaines is here. She's file number 10, AB 572. That will be immediately followed by Assemblymember Eggman. Assemblymember Gaines, when you're ready, please proceed.
Thank you, Mr. Chair. I will begin by accepting the recommended technical amendments proposed in the committee analysis. Diabetes has reached epidemic levels in California. As of 2012, about 1 in 7 adult Californians have diabetes, and many more will be diagnosed in the near future. Diabetes costs California over $29 billion a year and is increasing every year. No one is immune, and it could strike at any time. Today, the state of California has no action plan in place to address the escalating fiscal impact of diabetes. While there has been extensive legislation enacted to promote awareness and cost-saving measures for conditions such as cardiovascular disease and tobacco addiction, current law is woefully inadequate in regards to diabetes. AB 572 would require the Department of Public Health to create and submit to the state of California a diabetes action plan. The goal of this plan is to address the escalating impact of diabetes to the state. The plan will use evidence-based strategies aimed at prevention and awareness of costly diabetes-related complications. The plan will also detail the financial impact on the state, as well as provide policy recommendations aimed at preventing diabetes in California. Thank you. I respectfully request your aye vote on this bill, and with me here today to testify is Dr. Francisco Prieto, representing the American Diabetes Association.
Please proceed.
Thank you very much. Good afternoon, Chairman Bonta and members of the committee. I want to thank you for giving me the opportunity to testify. My name is Francisco Prieto, and I'm representing the American Diabetes Association, an organization that I've served as a volunteer both nationally and locally for many years. I'm a physician practicing locally in the Elk Grove area, and I treat a great number of patients with diabetes. I'm here to convey our support as the association for AB 572. The American Diabetes Association supports AB 572 because it will result in the development of a diabetes action plan, which will include information about the impact of diabetes on the state, the incidence of diabetes and its complications, the resources that are currently being applied, and the financial burden that diabetes imposes on us. The plans will bring back to the legislature policy recommendations to reduce the incidence, reduce the burden of diabetes, and a range of actionable items for consideration by the legislature. Part of this plan will be a budget blueprint identifying the resources that would be necessary to implement each item. The plan would be provided to the legislature biannually, allowing members to have current information on what the state is doing to address this epidemic and how those efforts could be improved. Every day, thousands more people are diagnosed with diabetes, over 3.8 million Californians, or over 13% of our population. This figure doesn't include those who are not yet diagnosed. It doesn't include the much larger population, over 10 million in California alone, with prediabetes, who are at risk of developing diabetes within a short number of years. Diabetes carries a tremendous burden for us. It is one of the top 10 leading causes of death. It doubles the risk of the leading cause of death, heart disease. It is a leading cause of blindness, of amputations, of kidney failure. In addition to the personal burden, it has an overwhelming price tag. A report in Diabetes Care estimated the cost to California at $37.1 billion, $27.6 for the direct costs, and almost $10 billion from indirect costs of lost productivity. With the diabetes epidemic, we are not allocating the resources wisely or in sufficient amounts. In January of 2015, the state auditor issued a report indicating that during 2012 and 13, California had the lowest per capita funding for diabetes prevention in the nation. Those of us who are trying to fight diabetes in California know that, unfortunately, diabetes is winning. If we have any hope of reducing the burden both on California's people and on our budget, we have to act. Developing a diabetes action plan will pull together data, assess what's being done, and map out a plan to reduce this burden. On behalf of the ADA, I urge your support for AB 572. This plan would mean that you as decision makers will have a clearer picture of what needs to be done to stop the diabetes epidemic. Thank you.
Thank you. Additional witnesses in support?
Jerry Jeffy, representing the California Chronic Care Coalition, in support.
Gary Passmore on behalf of the Congress of California Seniors and a diabetic myself. Strong support.
Maureen Higgins representing Biocom in support.
And Mike Carpenter representing CHI in support.
Philip Bautista, American Nurses Association Membership Director. We support.
John Lee, future registered nurse. I support.
Amy Bauk, Sac State nursing student, in support.
Additional witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Assemblymember Gaines, can you please clarify your position on the proposed amendments?
We're accepting them.
Thank you. Any comments or questions from members? Assemblymember Rodriguez.
I'd like to thank the author for this bill. Just tell you a little bit about my experiences in the healthcare field. That been in the industry for over 30 years, and back then really didn't hear a lot of diabetic patients that we're responding to. But fast forward to where we're at now, I would say over half of the patients we transport to the hospital are diabetics, and some didn't even know they were diabetics. That because they didn't even know. I mean, diabetes seems like to be a silent illness, disease with some folks. So I'm glad that you're bringing this legislation forward, because we need to be better prepared for treatment prevention of this disease. So I want to thank you very much. Show that I am in support of your bill. Thank you.
Thank you, Assemblymember.
Additional comments or questions from committee members? The committee can entertain a motion. We have a motion. We have a second. I want to thank you for bringing this important bill forward, Assemblymember Gaines, and for addressing the important issue of diabetes in California. I have an IRECO on this bill. The motion is due pass as amended to Appropriations Committee. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chu? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Lackey?
Aye.
Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? Thurman? Waldron? Wood? Aye. Wood, aye.
The vote count is currently 8-0. You need 2 more aye votes before it can pass out of committee. The bill will remain on call.
Thank you very much.
Thank you.
Thank you, members.
Thank you.
I see Assemblymember Gatto here, and with my deep apologies to Assemblymember Eggman, we're doing the bills in file order. No one else can jump in front of you after Mr. Gatto goes. So we're going to go with Assemblymember Gatto, and then Assemblymember Eggman, and then I know there are a lot of folks, members of the public here for AB 366. We'll follow Assemblymember Eggman with a presentation of AB 366. Assemblymember Gatto, whenever you're ready.
Thank you very much. So I'm here to present Assembly Bill 170, which has to do with the privacy of genetic information and the privacy of bodily fluids. I want you to imagine for 1 second that you or your constituents go and get a blood test. So this could be someone in college who goes to get tested for HIV. This could be somebody who is elderly, and the elderly person goes and gets a test for diabetes, for adult onset diabetes. It could be any of us who goes and gets a test for cholesterol. So you do a good thing. You go and get that blood test, and you screen for a bad thing. You screen for a bad disease. Once that test, that cholesterol test, that HIV test, that diabetes test is done, whoever tested your blood destroys that sample. They have done their purpose. They have screened you for that bad disease, whether it's HIV, cholesterol, or diabetes, and they now destroy the sample. That's how that works for all of us adults. Now I want you to imagine that instead of destroying your blood, that the government took custody of it. And then the government sold it. Sold your blood, your DNA, to a for-profit researcher to experiment on. And now I want you to imagine that that's what's happening to all the children born in the state of California, because that's the situation that we are in. All of us here support the initial screening program. And it's very important because there's a lot of misinformation on this bill to distinguish between the initial screening program and the ongoing experimentation that can occur years in the future. Just last year, as chairman of appropriations, despite great, profound costs to the state, I carried a bill, I joint authored a bill with Dr. Pan to expand the newborn screening program. And this bill does not touch the newborn screening program. My staff passed out to all of yours this chart that has to do with 3 components: consent or information being passed to parents, the screening of all samples for genetic diseases, and then the third one is the perpetual storage of a child sample and the experimentation on it by for-profit entities. The thing that this bill changes is that last factor. You can imagine that if the government took a senior citizen's diabetes test and took that sample and sold that senior citizen's blood, there would be riots in the streets. We would have lobbying groups coming to us in full force saying how wrong it was to take someone's blood against their consent to do experiments on it, long after the initial cholesterol test or blood test or HIV test is done. Now, the opposition is going to say a lot of things. I've been in the legislature for a relatively long time. I don't think I've ever heard so much misinformation on a bill as I have on this bill. The opposition is going to say, well, gee, the screening does a lot of good. Yeah, the screening does a lot of good. And remember, we're not affecting it at all. This bill does not touch the initial screening at all. I said that 3 times. I'm going to say it probably 10 more during my presentation because we have to get that misinformation out there. But they're going to say, well, but the experimentation also does a lot of good. And yeah, I don't disagree with that. But what we're coming down to here are fundamental rights. We're coming down to the right of privacy, the right of people who might be afraid of their data being hacked, their genetic data of their children getting in the wrong hands, to say, no, I want to be able to consent to that. Any of you are donors on your driver's licenses? You have to know that you consented to that. It's not something that the government did. They don't just take organs, which can do a whole lot of good, without your consent. We could do a lot of good, too, if we put a roadblock on the road and we took a sample from every senior citizen who wants to get on the 80 freeway. And we said, well, gee, we're going to try to predict when you're going to die, or we're going to do screening and experimentation on your blood to try to find which diseases we can eradicate. Yes, we could do a lot of good if we do that, but we don't, because that's not what we do in this country. We do not take people's samples, store them indefinitely, and then do experimentation on them without consent. That's all that this bill does. Every child in the state of California can and should be screened. This bill does not change that, not one iota. Every child in the state of California still will be screened. But what it does do is it provides a modicum of information to parents, and then it gives them the option of saying, nah, I don't want you to store my child's blood for 40 years. I don't want you to experiment on my child's blood. I'm concerned that if a researcher gets hacked, my child's DNA might get in the wrong hands. And that is what these parents have a right to say. And they should have a right to say that. The opposition is going to come up here and say, well, gee, if we give parents information, this might result in some of our programs being determined as scary. I mean, think about for a minute how paternalistic that is. Think about for 1 minute how weird that sounds to say that we cannot give parents information, that we cannot tell parents what we're doing with their child's blood because they might be scared of it. I think California parents have a right. I think they're not that stupid, and I think that they should not be kept in the dark. The opposition uses some other inflammatory language. They say that, gee, if we somehow affect the amount of people who object later on to experiments being done 20 years after their child was born on their child's blood without their knowledge, that this is going to reduce the sample sizes of this group or that. 50 states have a program like this. 50 states. California is a very diverse place. There are 500,000 babies born every single year in this state. The idea that if some group of parents says, nah, don't store my blood forever, that it's going to affect the sample pool, that's just nonsense. Most of these studies are nationwide anyway. If they need Native Alaskan, for example, California does not have that population. They have to go to Alaska to get those samples. If a researcher wants to do a research on Caribbean populations, well, they tend to be clustered, Dominicans, groups like that tend to be clustered on the eastern seaboard. They're not in California. So this idea that somehow California has to have every group, and that if we inform California parents that some groups are somehow going to object to this in greater proportions, that's so paternalistic and so illogical that, I don't even want to have to address it. We have to. This program is a very, very, very valid program. I want to stress that again. I want to stress again that last year I joint authored the bill to expand the screening program. But, and there's a big but, the perpetual storage of a child's blood and the experimentation on it and the selling of those blood samples to for-profit researchers could end up getting the whole program thrown out with the bathwater. The minute that there is a high-profile hack, the minute that some child sample gets in the wrong hands, what are parents going to say then? What would you say if your child sample got out? What would you say if the most intimate genetic details of your child were exposed to the world? You would be out before the legislature, and pardon the pun, you'd be out for blood. You would say that this program needs to be deeply reconsidered. This is not a credit card number. This is not bank account information. This is your child's DNA. And we need to give parents just a little bit of information. What does anybody here have to hide? If we give parents a little bit of information, just saying, hey, by the way, and we used very, very good language in this bill. We said that the state of California wants to do experimentations on your child's blood, so would you please consent to, and I'm paraphrasing here, but would you please consent to allowing for-profit researchers, nonprofit researchers, to do tests on your child's blood sample and to storing it so that we can help others cure diseases? What does anybody have to hide? What is wrong with informing parents that that is what the state wants to do? The opposite of this, of course, is this notion that the state of California can bank anybody's DNA for any reason, whether they've committed a crime or not, and that they can sell it to anybody for any reason. And I don't think that's what anybody wants in the state. I don't think that's what the opposition means, but if you play what they say out to their logical conclusion, that is the only logical conclusion you can draw. I respectfully ask for your aye vote.
Thank you, Assemblymember Gatto. Any witnesses in support?
Please.
Okay. Any witnesses that support?
Just logic.
Please come forward.